All right. I think we're going to get started. I just wanted to welcome everybody to maximize your revenue
and minimize your stress.
So I am Peter Hawes. I'm the VP of Business Development here at NexTrust BillFlash.
And I'm Dan Gasway, the Director of Channel Development.
So we're going to be delivering this today. At the end, we will have a Q&A.
Awesome. Let's go ahead and get started with the next slide, Peter. So first and foremost, this is what we're going to review today. We're going to cover first understanding the impact of medical debt, both for the consumers and providers. We're going to explore all of the payment plans and the key components of effective patient payment plans, as well as the best practices for implementing those plans. And last but not least, all of the features of BillFlash PlanPay and how to put it to work for you guys. The percentage of people in the United States right now with healthcare insurance has actually increased over the past decade, and it's really with a noticeably large, sharp increase in 2014 when the Affordable Care Act came out. But despite over 90% of Americans having health insurance, 63% of those people with overdue medical expenses, they actually incurred medical debt while having insurance coverage. So that's posing a risk for all of us. There is actually an economic crisis in the United States right now. According to the Fed's 2022 Economic Well-Being of U.S. Households survey, approximately 37% of Americans don't have enough extra cash to cover a $400 emergency expense right now. And that's nearly 1 in 3 healthcare consumers out there. For those who require extensive care, it's actually not uncommon to accumulate mounting medical bills over time. And with a changing economic climate, which we're experiencing right now, finding ways to get out of this kind of debt has become increasingly difficult and presenting a real struggle for many of us, which means even less likelihood of providers getting paid for services they render. In addition to that, a patient who is in debt is more likely to avoid doctor visits and put needed tests or treatments on hold. This financial burden, of course, for patients leads to so much more than the economic stability. And as many of us are aware, patient obligation is over 50% of the healthcare dollar right now. And research shows that as patient financial responsibility rises, the likelihood of collecting those patient payments in a timely manner significantly decreases, and it's making it more essential than ever for practices to adopt efficient billing and payment processes. And also, failure to implement an effective process for collecting AR can have significant impacts on the financial health of your practice. But how significant is that impact? We're just going to do some math right here. With approximately 20% of all patients being sent to collections, that's quite a chunk of people, and the average medical bill sent to collections ranging anywhere between $750 and $2,600 per person, it's actually easy to calculate the impact of past due AR that can actually have on your revenue. So what we do is we take how many patients, you need to figure out how many patients your organization serve every year, and you need to calculate the 20% of that total number of the patients that you're seeing and multiply that by $1,850. And that will give you the average amount that's going to be sent to collections. And that is actually equal to the revenue that you're missing out on. So in a perfect world, patients would pay their medical bills in full as soon as they receive them. We know that's not going to happen, right? But unfortunately, that's just not the reality that we're living in right now. Most healthcare providers would usually rather receive a portion of that total amount owed than actually nothing at all. So this is where offering payment plans can become the perfect win-win solution for patients and providers. So offering those payment plans to your patients removes one of the biggest barriers to payment, the financial hardship, which many of us are experiencing right now in today's economy. But offering a payment plan to patients can make it simpler for them to tackle those medical expenses that seem out of reach to them right now. And what we want to do is break those down into more painless amounts over a period of time. So a patient who would usually not even open a medical bill due to their inability to pay for it in full may be more willing to enroll in a plan that allows them to cover the cost of those treatments. So in fact, 90% of patients indicate that they plan to pay their bill in full if they are given flexible payment options.
Did you say 90%?
90%. 90% of patients would pay for that in full. So a patient payment plan will serve as a practical solution for patients who have high medical expenses. They need costly procedures or don't have enough insurance coverage. But the patient payment plans help patients pay their healthcare costs over a certain range of time. That's what paid planning is. Instead of having them pay all at once, this allows them to manage their financial situation. So Peter, don't you have a recent experience that demonstrates this?
Actually, Dan, I do.
Nice.
It was just a couple of months ago. My wife and my youngest daughter, who's about 3.5 years old, they both ended up in the ER within about 30 days of each other. I am super grateful for the ER and the staff and everybody that took care of them. Luckily, everybody's okay, which is the positive. The negative, I guess, is that I was not anticipating $4,000 or $5,000 of medical bill that showed up right after that. And so what I personally did is I put it on a 12-month payment plan.
Awesome.
And, for a lot of people, it wasn't that, can I not afford to pay the bill? It's that I wasn't budgeted for or expecting to pay a bill like that.
Right.
And so I was actually really grateful to be able to put it into a monthly installment payment plan. It's an inconvenience for sure, but I'd rather have the inconvenience than not have access to the care.
Yeah. And come to find out, you probably didn't even need to go there to the emergency room. We know that's another story there. Okay. Going on to the next slide. So not only do payment plans benefit the patients, but they also bring advantages for healthcare providers. And I'm just going to talk about 3 of them right now. The first one is improved cash flow. So the patient payment plans, obviously they're a valuable tool to promote and sustain financial stability for healthcare providers. Instead of waiting for the payment in full, these payment plans, they provide consistent income over time, like I mentioned. That allows your healthcare facility to budget more effectively and maintain its revenue stream. And what does improved cash flow do? Obviously, it brings revenue stability to your practice. So moving on to that second bullet point here, increased patient satisfaction and loyalty. Healthcare providers can boost payment satisfaction and foster loyalty by providing access to payment plans that create a more economical route when covering medical expenses. So your patients recognize the value of the care that you provide, which obviously motivates them to pay off what they owe. So offering a system of installments emphasizes your interest in promoting optimal health outcomes while making sure your patients receive fair medical treatment. So what does increasing patient satisfaction do? Well, it does create that loyalty and they come back. And the last bullet point is reducing administrative burden. And isn't that what we're here to do, to reduce that burden? So offering payment plans, it simplifies the billing process, offering a practical solution to reduce those administrative burdens and alleviate that financial stress. And implementing automated payments is a time-saving measure that allows healthcare providers to direct their resources toward improving patient care instead of wasting time and money in attempts to collect past due AR or sending multiple statements that ultimately we know remain unpaid. And what I'd like to do right now is just turn the time over to Peter Hawes again, and he's going to talk about the rest of PlanPay here for us.
Thanks, Dana. I appreciate the context into PlanPay there. The last thing he mentioned was reducing the administrative burden. I think anybody that's listening to this webinar, that's where we're at. We have certain job functions and we're trying to help administer and offer these care services to people. And it's hard when we get caught up in chasing down past due payments. Our time is spent in collections or different things like that. And, so having this PlanPay option is really important for that. And, creating a PlanPay that's beneficial to patients and the practice, it's hard. If it was up to the patient, they would pay, very minimal. Sure, put me on a plan, $10 a month. If it's up to the practice, we want all of it. So finding that balance to where both needs are being met can be tricky. And so I just want to talk about, what are some of the key points that we need to consider in all of this? And so the first is flexible payment options. So understanding, what are the different terms that are available? What is it that we're offering? What are the different options that we can sit down and communicate with, which is bullet point number 2, having a clear policy in place, being transparent, but being able to communicate. And a lot of times, and so I want you to take note of this piece right here, which is most of the time it's discussing this prior to the care being given. So if we're going to end up in a PlanPay situation, that's okay. But hopefully it's something that's been discussed even before we've seen the patient. And then we can customize it based off of their financial circumstances. So we've talked about the flexible payment options, but we need to include this financial level of stability into that to understand, is it making sense? The last thing we want to do is set up a PlanPay and then have our patients miss payments because, it was too much. The whole reason we're doing PlanPay is to make it more affordable. Well, if we say, okay, we're going to break it into 3 payments of $500 each, but that just isn't something that they can get into the budget, then we're going to fail anyway. And then the last piece, once we've got that figured out, okay, we have the terms, it's going to be over 12 months, it's going to be $200 a month, we can set the day, then we need to make sure that it's integrated with our electronic billing system, right? We don't want to miss out on anything there. Auto pay, in my opinion, is vital to this. Now, in the BillFlash system that we're about to look at, when we're looking at the software, we can set it up to accept credit card payments or check payments. But obviously, I highly recommend that it's credit card and auto pay whenever possible, because it's going to be easier for the payer to not have to remember that they owe us every month when they're paying into the practice. And it's going to make the whole process more streamlined, and we're going to be more successful at it. So I know that as you look at these bullet points, you're like, Peter, aren't these the things we just talked about? Yeah, they are. But I just want to reiterate them and go over them again because repetition is key in this, right? We need to assess the patient's financial capabilities and needs. Are they going to be able to deliver on it? We need to educate the patients about available payment options and plans. It's that communication and transparency we talked about. Establishing efficient and effective processes, right, for the management of this. This has nothing to do with the patient. This is something we do in-house. But it's important that it's established and it's understood before we unroll it, right? Because this should be a pretty painless, seamless process. We just need to make sure that everybody that's using the system is trained on how to set up a PlanPay. And what are our policies? Are there going to be minimums? Right? Perhaps the practice isn't going to allow a PlanPay to be set up for less than $50 or less than $100, whatever it might be. But those are things that we need to establish preemptively. We want to make sure that the practice experience is good for the payer, but also for the practice. We want the best results. So then the last piece there is leveraging that technology and automation for the seamless implementation. And if we follow these steps, then we as providers can ensure a successful rollout of a patient payment plan that meets their individual circumstances, but at the end of the day also helps us reach our goals. So if your healthcare organization is looking to help mitigate medical debt while improving your practice's cash flow, then offering patients cost-effective payment plans can be a game changer. With BillFlash PlanPay, setting up automated patient payment plans is very simple. We're going to walk through the process right now. So if we take a look at it, let me grab my little laser pointer here. When we're inside of BillFlash, if you go to the Get Paid tab, now again, you can hover over the tab or you can click on it. But when we hover over it or click, you'll see there are different options that pop up. We're going to click on Manage Plan Pays. And once we've done that, then we're just going to navigate over to the button over here on the right that says Add a Plan Pay. Very straightforward, very simple. Once we've clicked on that button, then what we're going to do is we're going to add the criteria for the payer we want to create the payment plan for. So there's different ways we can search for them. We can search by their name, account number, form ID. I would recommend that it's the account number, because even if we searched for somebody by name, we would still have to verify that it's the right individual. So account number is what I would always lead with. You know, how many Chris Davises could you be seeing potentially, right? So it's that simple to get started. And then we're going to complete the details in the plan pay by adding internal agreement notes, right? So this one says, hey, the payers agreed to this payment plan to take care of outstanding balances. We're not charging interest for the payment plan. And then it's recorded by Terry Smith, office manager. Well, it looks like Smith and office got deleted there, but it all makes sense. And then we're just going to look at the monthly payment amount. We're going to look at the total number of payments. We're going to look at the date that it begins. We confirm the payer's email address. We're going to choose the merchant location. If you have multiple locations, we need to make sure that we have the right merchant location selected. And then we're going to select that payment method. Obviously, I already mentioned that we have card and check available. And again, I highly recommend that it is card. So after entering all that necessary plan pay details, this pop-up box is going to appear, prompting that, hey, the plan pay is in pending. It needs authorization. So there's 3 different ways you can authorize the plan pay. It can be through email, online, or paper. And you'll notice that below this right now, online is selected, and there's going to be a prompt that walks you through the necessary steps for that authorization method. Very straightforward. Okay, once the plan pay authorization's been completed, you'll see the newly created plan pay right here in your list of active plan pays under, again, the Get Paid tab and under Manage Plan Pays. That's where they all show up. Now, if we click into any of them, we're going to see the details of the plan pay. So there's going to be any scheduled payment dates. You're going to see payments that have processed, and you'll see the remaining balance, etc. So it's all right there, easy, just click right into that. Now, let's say we want a list of everybody that we have on plan pay for accounting purposes or upcoming meeting. It's pretty simple. We're going to go over the tab Run Reports. If you hover over it, you're going to want to click Standard Reports. You don't want the overview. I mean, if you do, it's fine. If you click on the Run Reports tab, then you just need to make sure you click into Standard Reports. Once you've done that, then you are going to come down to the filters, and you're going to choose the All Sub-Accounts, All Locations under Plan Pay. And then over here, Source, under the Payments tab. So, I'm sorry, right here, Payments. And Source, you're going to go for Plan Pay. And then that will go ahead and generate a list of everybody that you have currently using that feature. Very straightforward, very simple. So with Plan Pay from BillFlash, offering your patients flexible payment plans that ensure you get paid is simple and convenient. That's the point, right? Is we've provided a service, now we need to get paid. what are ways that we can do to make it more convenient for our payers to make sure that they have a good experience and that we receive compensation for what the service we've provided. And BillFlash PlanPay, as a reminder, is just one of the many features in the comprehensive suite of BillFlash solutions. So I would love to thank you for joining us. Obviously, if you have additional questions, schedule a demo, go to billflash.com. Whether you are new to BillFlash or an existing customer, we can get that scheduled for you and make sure you get the help that you need. But thank you for joining. Certainly appreciated having you here. We believe that we added some value to your day. But if there's anything you need from us, please feel free to reach out. Thank you so much.
Thank you.